and welcome back. Clomid has been used in the reproductive health sector as a fertility medication for over 50 years. There's been a lot of successful stories when it comes to the use of Clomid in treating infertility in women, and many women who would have otherwise not been able to have children have been able to successfully conceive and delivered healthy babies with the use of Clomid, and most of them have been able to deliver twins. A lot of women still have questions when it comes to the use of Clomid to get pregnant fast. So today I'm here to answer some questions about Clomid. So what is Clomid? The drug name of Clomid is clomiphene citrate and is used for the treatment of infertility in women. Another common question is, how does Clomid work? So Clomid is used to stimulate ovulation in women who are not able to ovulate. That is, women who are not able to develop and release an egg. It is a tablet taken by mouth, and this is how it works. Clomid works on the pituitary organ, which is in the brain, and causes it to stimulate the release of follicle-stimulating hormone and luteinizing hormone. These two hormones trigger the ovaries to release one or more egg follicles. So in effect, Clomid allows a woman to release an egg that can then be fertilized by a sperm. Let's get this right. Clomid can only be used by women who are not able to ovulate. If you don't have any issues with ovulation, then Clomid is not for you. So if you don't fall in this category and you take Clomid, you would experience the side effects, and you would experience them very severely. Now, how is Clomid taken? So the starting dose for Clomid is 50 milligram, and the total dose that is given is 5 tablets taken over a period of 5 days of a menstrual cycle. It is advised that you start taking Clomid on the 5th day of your cycle. So day 1 is the first day that you see blood, and you count from that day till the 5th day, then you start taking Clomid. It is advisable that you take the tablet at the same time each day for the 5 days, so you don't forget. If you don't have a menstrual cycle at all, then you can start Clomid at any time. It is expected that most women will fall pregnant after the first cycle, but if this does not happen, then your doctor would increase the dose a little bit and repeat the cycle. It is recommended that women can go through this cycle for up to 6 cycles, and at each repeated cycle, the dose is increased a little. Now, what is the success rate of Clomid? This is a question that most women have, because before you go into taking any medication, especially for the treatment of infertility, you would want to know if the drug would work or not. And Clomid has proven to be very successful when it is used for the treatment of infertility in women. It can make you fall pregnant really fast. And as I said, it is used only in women who are not able to ovulate. Approximately 7 out of 10 women treated with Clomid would ovulate, and approximately 4 out of 10 would conceive. Most women who would ovulate would do so within the first 3 months of treatment. If you're not able to conceive after 6 rounds of treatment, then your gynecologist or your reproductive health consultant would recommend another form of treatment for you. Our next question, which is one that a lot of women ask: does Clomid cause multiple pregnancy? Clomid can increase your chance to have twins by 5 to 10%, but multiple births of more than twins are rare. Now, what are the side effects of Clomid? Just like any other drug, Clomid has got some side effects, and it's worth taking note of these. So just in case you experience any, and is very severe, then you know you need to speak to your doctor about it. Side effects of Clomid include hot flashes, abnormal discomfort, which includes bloating and pain in your tummy, headaches, menstrual irregularities, including spotting between your periods, visual disturbances, including double vision and flashes. If you experience any of these, then make sure you let your gynecologist or your consultant know about it. Also, stomach swelling, weight gain, and shortness of breath. These are side effects that when you experience, then you need to let your doctor know about them immediately. Another common question that most people ask is, where can I get Clomid from? Clomid is a prescription-only medication and is most of the time prescribed by a specialist who is taking care of you. So it is normally a prescription that you get mainly from a hospital, and you can take that prescription to the hospital pharmacy or to the community pharmacy and get it dispensed. Do not purchase Clomid on your own online or from a community pharmacy on your own and start taking it. It doesn't work that way. If you're trying for a baby, there are other things that you can do apart from taking Clomid. In summary, Clomid is for women who are not able to ovulate. It's not for all women who are trying to fall pregnant. It can help you fall pregnant fast. If you're having difficulty falling pregnant, it is worth speaking to a doctor who would then refer you to a gynecologist. The gynecologist would do all the necessary tests to find out a specific treatment that would be suitable for you. Also, there are other things that you can do if you want to fall pregnant, and I have a full video on how to fall pregnant fast. I'm going to leave the link in the description box below for you to check it out. I just want to take this opportunity to say a big thank you to all our returning subscribers and all our new subscribers. You are all amazing. Thank you for being part of this community. It's so beautiful to see people coming in and out to watch our videos. Thank you so much. Please don't go away without giving this video a thumbs up. Share with your family and friends. And if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our interesting videos. Leave a comment in the comment section. Leave your questions also in the comment section. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.